This is going to be the manual muscle test for cervical extension. For the manual muscle test, grade 3, 4, and 5 are all done in the prone position with arms by the side and head off the table. So Maddie, if you don't mind, I'm going to have you lift your head up, but keep your eyes towards the ground. Perfect. Come back down. Any pain with that? Awesome. Then I'm going to take her through the same motion. Passive and active are the same in this situation, which is awesome. Now what I'm gonna have you do, Maddie, is I'm gonna have you lift up your head in that position, hold it, and I'm gonna try to apply pressure over your parietal occipital region in a downward motion, and you resist me. Does that sound good?
Sure.
So relax first, okay? And then so one hand's gonna be pushing and the other hand's gonna be underneath the chin just for in case the neck gives out. So I'm gonna have you lift up your head. Perfect, hold that position. 5, 4, 3, 2, and 1. Perfect, you can relax. I would give that manual test 5 out of 5. If it were grades 2, 1, or 0, you actually do that in supine, and you either have the patient try to push pressure into your hand, and you palpate for any trace activation. So this is going to be the manual muscle test for trunk flexion, and in particular the upper abdominals. To do this test, you're going to have your patient in supine, and every grade is going to change how the patient is positioned. So I'm assuming my patient's going to be 5 out of 5 for muscle strength. So in that position, you're going to have them fingertips on the back of your head. Awesome, Matt, if you could do that for me. And then we're going to have them do a sit-up to an extent. And then as a therapist, you can stabilize over the pelvis as to not bring the hip flexors too much into play. So what we're looking for is that the inferior angle of the scapula gets off the table, and then we're going to have our patient hold it for 5 seconds. So we'll try this grade. If she doesn't succeed, then we can go down grade. So what I'm going to have you do, Maddie, is lift your, do like a sit up, and then just worry about getting the shoulder blade off.
Am I supposed to hold it?
Yeah, you can hold it. So come up, 5, 4, 3, 2, and 1. Relax. And then I do checking active versus passive, a little bit challenging. This table's nice because I can use it, and I'll have you just relax here, Maddie, and I'm just gonna go up, and you can see active and passive are relatively the same with that. So if she could not tolerate that, so her manual test was 5 out of 5, but if she could not tolerate that, the position's still the same. You're gonna be supine with your legs straight, except grade 4, you're gonna have the arms overlapping the chest. If she cannot succeed there, you go to grade 3, which is going to have the arms straight by the side of the body. If she can't succeed there, she goes to grade 2, which she goes into hook lying, so she bends her knees, puts her arms on the table, and then if she's not successful there, you go to the therapist cradling the upper trunk and head, and then asking them to try to lean forward. And then finally, if that's not successful, again, you're going to be, as a therapist, cradling the upper trunk and head, and ask the patient to cough and see if you feel any trace muscle activation. This is going to be the muscle test for the Sarman's level 4. To do this test, we're going to have our patient in supine. And what we're going to do first is we're just going to bend both their knees up, Maddie. And this is a test for core stability. So we're going to see, can you keep your core engaged, keep your spine in a nice solid position while you move your lower extremities. So in a second, we'll work on engaging the core, but when our core is engaged, what we're going to do is we're going to come up into a position where our hip is at 90 degrees, our knee is at 90 degrees. We're going to slowly bring your heel down. Once you feel your heel touch the table, you're going to send both your legs. Again, the focus being in your core, staying engaged throughout, okay? So what I'll have you do is slide both your knees up. All right, let's get your core engaged. So tighten there, and I, as a therapist, you can use like a blood pressure cuff or other tools. I'm just gonna use my hand and have her keep adequate pressure into my hand the whole time. So what I'll have you do is tighten here, perfect. Let's go through that position, both legs, nice and slow. Slowly bring your legs down till your heels touch the table, and then straighten out your legs. Again, you're keeping great pressure into the hand. So that would be a pass at level 4. If she were to fail that, she would just go down to the next test position, level 3, and if since she passed, we could go to level 5. So this is going to be the range of motion measurement for lumbar extension. This test should be done in the standing position with your patient's feet shoulder width apart, and then you're gonna have your patient cross their arms and put their hands on the opposite shoulder. So Maddie, if you don't mind, I'm gonna have you come over here. I'm gonna have you face this way just so the camera get a good angle. I'm gonna have you stand feet shoulder width apart, which they are, and then I'm gonna have you put your hands on opposite shoulder. And what we're gonna be measuring is your motion to go backwards up the spine, okay? So what I'll have you do, I'm just gonna hold your hips here a little bit. I'm gonna have you lean backwards. Good job, keep your knees extended and then come back. Any pain or issues with that movement? Awesome. So we're gonna use a goniometer for this test. The axis is gonna be at the mid-axillary line at the level of the lowest rib. So if you palpate right about there. The stationary arm of the goniometer is gonna be vertical to the floor, and then the moving arm is gonna be along mid-axillary line. So what I'm gonna have you do, Maddie, is do that same motion where you lean backwards, lean, and then come back. Perfect. And I'm getting about 38 degrees. The anatomical norm is about 25 to 35, so she's a little bit hypermobile with that movement. And then to check passive, I have a table here, so I'm gonna have you, Maddie, lay on your stomach and put your waist right at this crease. Relax the back, and I'm gonna go up. All right there, and I'd say she's got about a firm end feel right there. And any pain with that movement?
No.
Awesome. This is going to be the range of motion assessment for lateral flexion or side bending of the thoracolumbar spine. To do this test, you're going to have your patient in standing, erect with her arms by her side and palms to her body. I forgot to mention we're going to be doing the tape measure method. So what you're going to do is you're going to have your patient stand upright. You're going to mark a little line at the bottom of the long finger. And then Maddie, what we're gonna do is we're gonna side bend. So we're gonna go this direction without leaning forward or backwards, and then come back up. Sound good?
Mm-hmm.
Okay. I'm gonna have you go through that motion as far as you can. Again, do not lean forward or backwards. Awesome. And then relax. And then what you're gonna do is you're gonna measure the distance in between these two marks, and that's gonna be your value. So let me go ahead and measure this here. And we are getting about 18 centimeters. And then what you can do is you can check the other side to make sure there's a lot of symmetry and everything's good. And then no pain with that motion, correct?
Nope.
Awesome. This is going to be the range of motion assessment for cervical extension with a goniometer. To do this test, you're going to have your patient in the seated position, sitting up nice and tall. And what we're gonna do is we're gonna go through cervical extension, which is like you looking up to the ceiling. I'm gonna do it passively, and then I'll have you do it. So relax the head once. I'm gonna have you go back. Right about there is a nice firm end feel. Any pain with that movement?
No.
No. I'm gonna have you go through that same motion. Again, no pain, feels okay?
Yep.
Okay. To do this test with the goniometer, the axis is gonna be at the earlobe. The stationary arm is gonna be perpendicular to the floor, and then the moving arm is going to be aligned with the base of the nares. So sit up nice and straight for me. Let's see here. What I'm going to have you do, Maddie, is I'm going to have you look up towards the ceiling. Go as far as you can. Right there, perfect. And then relax. I'm getting about 58 degrees. The anatomical norm is 50, I believe, so she's a little hypermobile with that, but that's okay. This is going to be the range of motion assessment for cervical rotation. This test is going to be done in the seated position with the patient sitting as tall as possible. When doing this test, you do have to watch for compensations of making sure the patient isn't flexing or extending their head or laterally flexing their head, and then also to make sure they're not rotating at the body. So what I'm going to do is I'm going to take you through the motion, and then I'm going to go through it. So you get to relax the head. Here, oh, there's nice firm end feel. Any pain with that movement?
No.
Can I have you go through the same movement? Good. Okay, how'd that feel? Any pain?
Good. No pain.
So we're going to be using the goniometer in this test. The axis is going to be on top of the patient's head. The stationary arm is going to be an invisible line between both the chromium processes, and the moving arm is going to be in line with the nose. Okay. So I'm just going to get above you here, and what I'm going to have you do is do that same movement. Rotate, rotate, rotate. Is that about as far as you can go?
Yeah.
Awesome. I'm getting about 74 degrees of right cervical rotation, with the norms being up to 90 degrees, so she is perfect.